Hello! You are watching this video because you or someone close to you has an implanted central venous catheter, also called a port. All healthcare providers, usually a nurse, who access or insert the needle into the port have been trained on the sterile technique and proper care. However, there may be subtle differences in how they do this. It is important that you know how the catheter should be cared for. It's also important that you speak up if something seems different from usual.
This video will show you the general principles on how your port will be cared for, but it is not intended to teach you how to access your port.
Before accessing your port, you'll be asked if you use a medication to numb the site. This can be a small injection of numbing medication right before the needle is inserted, or a cream that's applied to the skin at least a half an hour before. Some patients prefer not to use anything.
Only special needles can be used to access a port. It's called a non-coring needle, and it's shaped to not damage the port when inserted.
The first step is always for the nurse to wash their hands. Hand hygiene is one of the most important practices for infection prevention. Next, we gather all of the supplies needed.
Once the numbing medication is working, it is important to assess where the port is under the skin.
The site is felt to determine exactly where the non-coring needle will be inserted.
At this time, the site is also checked for redness, swelling, or drainage. Tell us if you have any pain at the site.
Once a work area has been cleaned, the nurse opens the central line kit, puts on a mask, and offers one to you. If you're unable to tolerate wearing a mask, you'll be asked to turn your head away from the port site.
Before proceeding, your nurse will wash their hands again. The needle is placed on the sterile towel from the kit. The nurse puts on sterile gloves. The needle is filled with normal saline, being sure not to touch or contaminate the rest of the sterile field.
Using chlorhexidine, the port site is cleaned by scrubbing the area up and down and sideways for 30 seconds. Allow to air dry. Never wave or blow over the area to dry it.
Once the area is dry, the port is immobilized by pressing down on the base of the port around the center. Using sterile technique, the needle is inserted into the center of the port.
Correct placement of the needle is confirmed by pulling back on the syringe and getting a blood return. Then the port is flushed by pushing in the saline. The saline should go in easily and not be painful. If a good blood return is not obtained or if flushing meets resistance, your nurse will troubleshoot reasons why this may happen.
One possible cause is that the needle isn't in the correct place and it may need to be reinserted.
Sometimes a blood return is not obtained because of the port itself. If that happens, the nurse will contact the doctor managing your care.
After the port has been accessed and flushed with saline, a sterile transparent dressing is put over the site. Medications can now be administered or infusions can be attached to the inserted needle.
While a central line is necessary for your care, it can increase your risk of infection. To minimize that risk, we will use a vein in your arms or hands to draw blood whenever possible. This is the safest way to prevent infection. We will continue to use the central line to administer medication.
When your treatment is complete, or after 7 days, the non-coring needle will be removed. Only trained staff should remove the needle from the port.
The nurse first washes their hands and then gathers the necessary supplies.
Before a non-coring needle is removed, the port will be flushed with normal saline and heparin.
Heparin minimizes the risk of blood collecting on the end of a catheter. Blood buildup at the end of the catheter can form a clot and prevent the catheter from working properly. The concentration of heparin is ordered by the physician.
Before putting on gloves, your nurse will wash their hands. Non-sterile gloves are used to protect the nurse. The catheter cap is scrubbed with alcohol for at least 15 seconds. The port is then flushed with normal saline and then heparin. There should be no resistance to the flushing.
Removing the needle usually does not hurt, but can cause a little bit of discomfort. Some patients find taking the dressing off the most uncomfortable part of the procedure.
The dressing is removed, being careful not to pull on the needle. The site is again inspected for any redness, drainage, or swelling. We will report any of these concerns to your doctor.
The non-coring needle that is on the outside of the skin is held with one hand, and the needle is removed by lifting up until the needle is out of your port and in the safety housing. The needle is discarded in a sharps container.
You or the nurse will cover and hold pressure on the site with gauze. A little oozing of blood is normal. When there is no longer any bleeding, a sterile gauze or Band-Aid should be placed over the site. You can remove this in a couple of hours.
You will receive a passport or a passbook, which includes all of the specific information for your port. You should always present this to care providers when you are receiving care. You should also make sure that anyone who cares for your port follows all the steps for preventing an infection. This includes washing their hands, scrubbing the cap for 15 seconds, and using aseptic technique.
You are an important partner in the care of your port and for making sure that your port is cared for properly. If you have any questions about your port, please ask your nurse or physician. Thank you.